Hello, and welcome to Vox Herald, the podcast that brings you the stories shaping Canada today. I'm your host, San Juan, and I'm here to dive into the issues that matter to our communities, from coast to coast to coast. Today, we're talking about a troubling incident in Yellowknife, Northwest Territories, where an explosion linked to propane huffing left one person in critical condition and raised alarm bells about inhalant abuse. This story isn't just about one event. It's about the broader challenges of addiction, mental health, and access to care, especially in Canada's north. Stay with us as we unpack what happened, why it matters, and what it means for Canadians. Let's start with what happened in Yellowknife last week. According to the RCMP, an explosion rocked a downtown neighborhood when someone was huffing propane from a parked boat. The blast scattered debris, caused significant damage, and left one person in critical condition. While the age of the individual wasn't disclosed, local youth organizations have raised concerns about young people using inhalants, a practice that's not new but is deeply concerning. Inhalant abuse, or huffing, involves inhaling volatile substances like propane, gasoline, or household chemicals to get high. It's a dangerous practice, and in Yellowknife, the RCMP reported 37 cases of huffing or sniffing between July 2023 and now, with 9 incidents already this year. That's a significant number for a city of about 20,000 people. Police have also noted thefts of fuel containers, 4 gasoline and 5 propane containers in the last 2 years, prompting calls to lock up these substances to prevent misuse. This isn't just a Yellowknife issue. Inhalant abuse is a problem across Canada, particularly in remote and northern communities where access to other substances might be limited. To understand why this matters and what's at stake, let's dig deeper into the implications social, health, and cultural for Canadians, especially those in the North. First, let's talk about the health risks. Dr. Andre Corriveau, the Acting Chief Public Health Officer for the Northwest Territories, explains that inhalants like propane can displace oxygen in the lungs, leading to cell death within minutes. Propane, being a heavier gas, lingers in the lungs, causing prolonged damage. Seth Fletcher, a Toronto-based addictions counselor who's worked in Nunavut, describes seeing the physical toll firsthand: damage to the respiratory system, nasal cavities, nerves, and even compromised breathing. These are serious, sometimes irreversible effects. Beyond the physical, there's a deeper story here. Fletcher points out that inhalant abuse is often tied to underlying mental health issues or attempts to self-medicate. In northern communities, where access to mental health services is limited, inhalants like propane or household chemicals become an accessible escape from pain, trauma, or stress. According to a 2019 report from the Canadian Institute for Health Information, only 1 in 5 Canadians in rural and remote areas have timely access to mental health services, compared to 1 in 3 in urban centers. In the Northwest Territories, with a population of about 45,000 spread across vast distances, this gap is even starker. This brings us to a cultural and social perspective. The North, including the Northwest Territories, is home to many Indigenous communities who make up about 50% of the territory's population, according to Statistics Canada. Historical trauma, including the legacy of residential schools, coupled with ongoing challenges like poverty and housing shortages, can contribute to substance abuse as a coping mechanism. A 2021 report from the National Collaborating Center for Indigenous Health highlights that substance use disorders are often linked to systemic inequities. Yet treatment programs tailored for Indigenous communities are scarce. Economically, inhalant abuse places a burden on Canada's healthcare system. The Public Health Agency of Canada estimates that substance use disorders cost the country over $46 billion annually, with hospital stays and emergency care being major drivers. In a small community like Yellowknife, an explosion like last week's not only endangers lives, but also strains limited emergency resources. From a policy angle, the RCMP's call to lock up propane and fuel containers is a practical step, but it's a band-aid solution. Fletcher emphasizes that addressing inhalant abuse starts with understanding the why, the root causes like mental health struggles or lack of opportunity. This means investing in accessible mental health care, addiction treatment, and community programs, especially for youth. In the Northwest Territories, where there's only one residential treatment center, wait times can be long, and travel to southern facilities is costly and isolating. To bring in a community voice, let's consider the perspective of youth organizations in Yellowknife. The head of a local group, as reported by CBC, has long been concerned about young people turning to inhalants. Youth in northern communities often face unique challenges: limited recreational opportunities, high unemployment rates 11.2% in the NWT compared to 6.5% nationally per Statistics Canada, and exposure to intergenerational trauma. Programs like youth mentorship or cultural activities rooted in Indigenous traditions could offer healthier outlets, but funding for such initiatives is often inconsistent. From an Indigenous perspective, community-led solutions are critical. Initiatives like land-based healing programs, which combine traditional knowledge with mental health support, have shown promise in places like Nunavut. Yet, as Fletcher noted, post-treatment support is just as important to prevent relapse, and this is where Canada's North often falls short. Now, let's take a closer look at the data and trends to understand the scope of this issue. According to Yellowknife RCMP, the 37 documented cases of huffing or sniffing since July 2023 likely underrepresent the problem, as many incidents go unreported. Compare this to national trends. A 2018 study by the Canadian Community Health Survey found that 1.3% of Canadians aged 15 and older reported using inhalants at some point, with higher rates among youth and marginalized groups. In remote communities, the prevalence is likely higher due to accessibility and socioeconomic factors. Cross-referencing this with health data, the Public Health Agency of Canada reports that inhalant-related hospitalizations are rare but severe, often involving neurological or respiratory complications. In 2023, Canadian hospitals saw approximately 1,200 admissions linked to inhalant abuse, with costs averaging $10,000 per case. In the Northwest Territories, where healthcare infrastructure is limited, these cases can overwhelm local hospitals. Looking at regional differences, the Northwest Territories faces unique challenges compared to urban centers like Toronto or Vancouver. For example, Ontario has over 50 addiction treatment facilities, while the NWT has just one. This disparity highlights a broader issue of healthcare inequity in Canada's North, where fly-in communities may wait weeks for specialized care. The federal government's 2023 budget allocated $198 million over 3 years for mental health in Indigenous communities. But advocates argue this funding is spread too thin to address urgent needs. Another angle is prevention. The RCMP's focus on locking up propane is a start, but public health campaigns could raise awareness about inhalant risks. In Australia, for example, community education programs in Indigenous communities reduced inhalant abuse by 20% over 5 years, according to a 2022 study. Canada could adapt similar strategies, combining public awareness with culturally sensitive interventions. That's today's deep dive into the Mundi, Yellowknife explosion, and the broader issue of inhalant abuse in Canada. This story reminds us that behind every incident is a complex web of challenges: mental health, systemic inequities, and access to care. For Canadians, especially in the North, addressing this means investing in community solutions, from youth programs to mental health. services that reflect our diverse realities. What do you think about this issue? Have you seen the impact of substance abuse in your community? Share your thoughts on X at Vox Herald. We'd love to hear from you. Until next time, stay informed, stay connected, and let's keep building a healthier, more inclusive Canada together.